It is also referred to as E&M or EM. So, the first question which comes to mind is, what is an E&M service? An E&M service is a patient and physician encounter where the physician assesses the patient based on the chief complaint or symptoms and history of presenting illness and plans of managing the problem. There are various types of services based on new vs established, initial vs subsequent or progress of care, and the reporting of E&M service is also based on the place of service performed. Here I will be discussing the places of service like office visits, outpatient, hospital visits, inpatient, emergency department visits and observation services. Office visits. These are visits where a physician sees the patient in his clinic or office. It could be a new or established patient or a consultation visit. Hospital visits. These are visits where the patient is admitted into the hospital as an inpatient and care is being provided. These visits are referred to as initial inpatient, subsequent inpatient or consultation visits. Subsequent visits are also referred to as progress notes. Emergency department visits. The emergency department is also referred to as ED or ER. Patients who require immediate medical attention come in the emergency department. There is no segregation of the visits type in ED. Every patient who visits the emergency department is considered as a new patient. Observation care. There are times when a physician keeps a patient under observation for some time to ensure the quality and outcome of the treatment. This is based on the severity of the problem and the type of management option selected. This service is referred to as observation care. To report the above-mentioned services, there are specific CPT codes for every type of evaluation and management services performed. These codes are based on the visit types, level of care given and place of service. Below are the CPT codes used to report or bill the evaluation and management service. For the outpatient, there are 5 levels of care for new and established patient types. New patient, 99,201, 99,202, 99,203, 99,204, 99,205. Established patient, 99,211, 99,212, 99,213, 99,214, 99,215. These are also referred to as level 1, 2, 3, 4 and 5 as they have these numbers as the last digit of CPT. For inpatient, there are 3 levels of care in each patient type. Initial inpatient, 99,221, 99,222, 99,223. Subsequent inpatient, 99,231, 99,232, 99,233. For the emergency department, there are 5 levels of care. Emergency department, 99,281, 99,282, 99,283, 99,284, 99,285. For the observation care, the CPT code sets are based on how long the patient stayed in the care. If the patient was admitted and discharged on the same date, it is called same-day admit and discharge service, and if the patient stayed longer and received services on 2 dates, it is referred to as a different date discharge service. There are different sets of CPTs for both type of service. Same-day admit and discharge. There have 3 levels of care to report this service, which are 99,234, 99,235, 99,236. Different date discharge service. To report a different day discharge from observation care service, there are 2 sets of CPT codes, which are segregated based on the service given on the initial day and subsequent days. Initial observation care, 99,218, 99,219, 99,220. Subsequent observation care, 99,224, 99,225, 99,226. There is also a CPT code to report the discharge service from different date observation care, 99,217. Consultation service. There are times when a physician wants their patients to be evaluated by the other physician or physician of specialties departments to make a better decision or management plan. And there are times when a patient wants a second opinion on the care they are receiving or about to receive. These are consultation services. CPTs to report these services are based on inpatient or outpatient status. These services have 5 levels of care for both patient statuses. Outpatient consultation, 99,241, 99,242, 99,243, 99,244, 99,245. Inpatient consultation, 99,251, 99,252, 99,253, 99,254, 99,255. These are the few types of E&M services and CPTs to report the service, which are used very frequently. There are also many other types of services performed under E&M. They have their designated CPT and guidelines to report. Thanks for reading.